Good evening, everyone. So, my next topic, which I'm going to discuss with you, is on the topic adverse drug reactions. And before I start my video, I want to request you that if this video is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you adverse drug reactions. History. Now, there was history of thalidomide and diethylstilbestrol. Thalidomide disaster was seen in 1961. It was seen that the pregnant females who were suffering from morning sickness, that is vomiting, they were taking as thalidomide as the sedative. And when their babies were born, that is the offsprings were born after the woman was taking thalidomide during her pregnancy as the sedative in the morning sickness, they developed the phocomelia. The offsprings developed phocomelia. This is sea-like limbs, short limbs they developed. This was seen in the offsprings of the pregnant females who were taking the thalidomide as the treatment. Diethylstilbestrol was seen in 1971. That is the females who were taking, the young girls who were taking diethylstilbestrol as the estrogen preparation. Their offsprings, their female offsprings, when they were afterwards, when they were pregnant, the female offsprings they suffered from vaginal carcinoma or cervical carcinoma in them, the offsprings of the females who were taking diethylstilbestrol, and it was discovered in 1971. Now, what is the adverse drug reaction? What is the definition of adverse drug reaction? It is any noxious that is harmful, unintended, which was not intended, and it was undesired effect of the drug, which occur at doses usually for which was used as the therapeutic doses, as the therapeutic doses of the drug for which was taken to prevent the drug, to prevent the disease, to diagnose the disease, or to treat the disease. At the therapeutic concentrations, the patient was taking the drug, and this unintended, noxious, harmful, undesired effect came. That is the adverse drug reaction. And it does not include the overdose, that is poisoning, or underdose, that is therapeutic failure, or prescription errors. It is not included. Areas do not include poisoning, therapeutic failure, and medication errors. So AGR, it is the noxious change which is suspected to be due to a drug, occurs at doses normally used in men. Normally used means therapeutic doses, which are normal doses given to the patient, and side effects come. And the required treatment or decrease in dose indicates caution in the future use of the same drug. Means they require treatment. Means if the side effect is very harmful, is unintended noxious, that requires treatment, or we can decrease the dose of the drug, or we can in the future also we have to avoid that drug because of that adverse reaction. Now, according to time of occurrence of the action, according to the time, this has been onset, it has been divided into acute, subacute, and latent. According to severity, they have been divided into mild, moderate, and severe. And according to types, they have been divided into A for augmented, B for bizarre, C for continued use or chronic, D for delayed, and E for end of course. These are the types of the areas which I'm going to discuss with you one by one, the classification of areas. Now, according to acute is less than 24 hours. If the reaction has occurred less than 24 hours, that is acute. Subacute is from 1 to 7 days it has occurred. From greater than 24 hours to 7 days, if the onset is up till that, then it is subacute, and latent is after 7 days. If the adverse reaction has occurred, it is a latent. Mild is which does not require any change of therapy, which is very mild or it is bothersome, but it requires no change in the therapy. Moderate is it requires change in therapy, or it requires additional treatment or hospitalization, adverse reaction. And severe is that which is very disabling and which can be life-threatening. The classification of the ADR according to types are type A, B, C, D, and E. I have already told you augmented, bizarre, chronic, delayed, end of dose. Augmented is because of the mechanism of action of the drug. The reaction has occurred, the side effect has occurred because of the mechanism of action of the drug, the pharmacological action of the drug. It is the augmented, and this is the predictable ADR, and it is dose related, like antihypertensives, which produces vasodilatation, like ACE inhibitors, angiotensin receptor blockers, calcium channel blockers. They produce vasodilatation and they decrease the BP. So there can be orthostatic hypotension in them with antihypertensive drugs, and it is the pharmacological action of the drugs. In the same way, we can say there is anticholinergics, there is dry mouth, as anticholinergics decrease the secretions, so there can be dry mouth. And with the propranolol, there can be heart block because they cause bradycardia and they depress the heart. So with the propranolol, there can be sinus bradycardia can occur. These are the types of the augmented type A. Bizarre or idiosyncratic is it is having the higher mortality. It is the according to genetic makeup of individuals. It depends genetically. It just doesn't depend upon the any pharmacological action. It is bizarre or idiosyncratic depending upon the genetic makeup of the individuals. It has inter-individual variations. Like penicillin, some persons they are sensitive or to penicillin. There can be drug sensitivity to penicillins. So penicillin is related anaphylaxis. In the diagram, we can say there is swelling of eyes, lips, of the face, and there is a redness, edema of the faces there. This is anaphylaxis. Chronic is when there is continued use of the drugs has occurred, and that can lead to tardive dyskinesias by the antipsychotic drugs. Antipsychotic drugs can lead to tardive dyskinesia, which is the side effect of the antipsychotics like haloperidol, triflupromazine, or uh, amisulpride. All these drugs, risperidone, these drugs produce tardive dyskinesias, which is the chronic or which comes after a longer period of use of the drug. Like there can be trunk protrusion, there can be lip smacking, there can be mouth puckering, there can be facial grimacing, and there can be excessive eye blinking, and there can be breathing movements. These are the tardive dyskinesias by antipsychotics. T is the delayed, means which occurs after the stoppage of the drug, and there is a delayed action has occurred. Like there can be teratogenicity, which is the delayed action in the pregnant females. So there can be fetal hydantoin syndrome or corneal opacity after thyroidazine, which is the again antipsychotic drug that can lead to corneal opacity. So that is delayed effect. Type is end of dose, means we have stopped taking the drug and suddenly the withdrawal reactions have occurred, like seizures on alcohol and benzodiazepine withdrawal, like convulsions have occurred because of the alcohol or benzodiazepine withdrawal, like dependence withdrawal reactions has occurred. That is end of dose. What's the difference between adverse event and adverse drug reaction? Now, it is the adverse event is the untoward occurrence after exposure to a drug that is not necessarily caused by the drug, means it has no causal relationship, that an untoward occurrence has no causal relationship with that of the drug. Like the patient who is suffering from insomnia and is on benzodiazepines, so there will be sedation in that patient, like lorazepam is given or diazepam is given. So when the patient is driving, there can be fall or there can be accident of the patient has occurred. So that accident, which is the adverse event, it is not because of the positive causal, it has no causal relationship with that of the drug. So that is, it is not caused by the drug, it has indirect relationship, and that is the adverse event. And adverse reaction is the reaction which has the uh, suspected to be due to the drug and occurs at normal doses, require action. Like this is the suspected connection to the medication, adverse event, and this is the confirmed connection to the medication, adverse drug reaction. Now, categorization of the areas, like we have the side effects. Like antihistamines, have already told you sedation because of the pharmacological action of the antihistamines is producing the sedation. So that is a side effect. And like secondary effects are tetracyclines when we take, and after the use of tetracyclines, there can be suppression of bacterial flora. Toxic effects when we give the drug in overdose, like morphine is the drug, opioid analgesic. When it is given in overdose, it can lead to respiratory depression, ultimately leading to respiratory failure, and death can occur. Intolerance is toxic at therapeutic dose only. Like chloroquine, which is the anti-malaria drug, it is toxic at the therapeutic dose only. Idiosyncrasy is the desire, that is the genetically determined abnormal reactivity. Like barbiturates, they cause the mental excitement. And allergy like type 1, type 2, type 3, and type 4 hypersensitivity reactions can occur. And dependence is that can be physical or psychological because of the drug of abuse like opioids, barbiturates, alcohol, benzodiazepines. These are drugs of abuse and they can produce the physical as well as psychological dependence. Psychological dependence is when there are no withdrawal symptoms and the patient just craves taking the drug. And physical dependence is when there is withdrawal symptoms like there can be salivation, lacrimation, there can be tachycardia, palpitations, increased heart rate, arrhythmias can occur, sweating, all the symptoms, diarrhea can occur. These withdrawal symptoms will occur when we stop giving the drugs. Keratogenicity like thalidomide, which causes the phocomelia in the offsprings of the pregnant women who were taking thalidomide as the sedative in morning sickness. Drug-induced or iatrogenic means without any cause. It is drug-induced, like peptic ulcer, then known to be caused by these non-steroidal anti-inflammatory drugs, which are the analgesic drugs. They cause bleeding and they cause erosion of the gastric mucosa leading to peptic ulcer. Now, these are the various abnormal deformities, adverse aggression due to teratogenicity. That is cleft lip, which is caused by phenytoin, cytotoxic drugs like methotrexate. There is deformity of the lip. Deformity of the palate is cleft palate, which can be caused by the anti-epileptic drug like phenytoin or immunosuppressant drug like methotrexate or corticosteroids. Spina bifida, when there is bifid spine, it can occur due to anti-epileptics like valproate and carbamazepine. Saddle nose, when the depression of the nose takes place, like this depressed nose, it can occur due to warfarin, which is anticoagulant. Hydrocephalus is fluid is filled in the brain and there is enlargement of the brain is there, enlargement of the head, which can be occurred due to arytenoids and methotrexate. And teratogenicity, where there is cleft lip, cleft palate, congenital anomalies, like there can be spina bifida, or there can be saddle nose. All these in combination can be caused by carbamazole, fetal hydantoin syndrome by phenytoin. Tetracyclines can cause the teratogenicity. Carbamazepine, valproic acid, and lithium. Lithium cause Amstein's anomaly. Photosensitivity means there is sensitivity to the sunlight because of the some drugs like sulfonamides, or they can be sensitivity due to tetracyclines also, nalidixic acid also, and fluoroquinolones also. Gingival hyperplasia of the gums, gum hyperplasia can occur due to phenytoin, which is the anti-epileptic drug. Stevens-Johnson syndrome is when there is vesicles and bullae formation and there is rashes in the face, in the mucous membrane, in the skin, in the genitals, and various organs of the body, in the skin. The vesicles are formed, bullae are formed, the erosions occur, and there is rash formation. It can be occurred due to ibuprofen, sulfonamides, and anti-epileptic drugs. Bullous eruptions, fluid-filled bullae are there on the surface of the skin of the patient, which is caused by penicillin and analgesics. Fixed drug eruptions when there is papules and macules and rashes and there's hypopigmentation is there. It can occur by the paracetamol, tetracyclines, vesicles formation, sulfonamides, aspirin, and dapsone. Now, causality assessment, I have already discussed with you. It depends upon the temporal relationship. Temporal relationship is time relationship. The challenge which we stop the drug and the reaction disappears. Or that shows that the drug was the causative agent of the adverse drug reaction. And the challenge when we reintroduce the drug, that is that can lead to again the adverse aggression. So that can confirm that that causality assessment is certain. Previous knowledge means about the pharmacological actions of the action of the drug, that has the previous knowledge of the drug. It can help in the in assessing the causality assessment. Now, the last slide is, I stopped taking the medicine because I prefer the original disease to the side effects. This is how the side effects are so dangerous that the patient stops taking the medicine, because the side effects are so dangerous that it affects the survival of the patient, or the living condition of the patient. Thank you. That's all with adverse aggression. I hope you understood my video. And if you like this video, and if it is helpful to you, kindly subscribe to my YouTube channel. That is Dr. Nitika Pharmacology Discussion. Thank you. Happy learning. Be happy. Stay safe. Stay healthy. Stay blessed. Thank you.